Now that the 18 to 34-year-old group can receive the COVID-19 vaccine, how will this important step help us achieve herd immunity sooner? Professor Hannelie Meyer, head of the African Vaccination and Immunization Center at the Sefako Makgatho Health Sciences University, joins us now to give us more detail. Professor Meyer, good evening and thank you very much for your time.
Good evening and thanks for having me.
I mean, the very most important and scientific question I suppose we would need to ask at this moment is, will the vaccination of the younger group save lives?
Yes, in my opinion, definitely. The more people we can vaccinate, the better. That's the only way that we are going to get hold of this pandemic. So I heard you refer to herd immunity. And we all know by now with COVID-19, it will be very difficult for us to actually achieve herd immunity. So as I said, yes, vaccination will be the only way to get as close as, getting hold of this pandemic.
Yeah. Does it work in this particular age group? I mean, many are arguing the fact that, for example, will it significantly reduce severe disease and hospitalization in this age group, which we've been told from the onset that they actually would experience very mild or even asymptomatic infections.
Yes, so it is true. I mean, with age and with, additional comorbidities, you have, your outcomes would be more severe should you get COVID-19. You could land up in hospital or you could even die. So it is definitely true. But what we must remember, we don't only vaccinate. We started off, by prioritizing those people, but we don't only vaccinate just for that reason. So if the youth and the younger people are also vaccinated, they actually protect those around them. Because everybody cannot be vaccinated. Some people, for some other reason, they might have a certain disease or on treatment, they cannot be vaccinated. While others, like the very elderly people, they have weakened immune systems and they won't, amount such a great immune response compared to younger people. So it is also about protecting those around you.
Right. And then, of course, there is the moral and ethical question, particularly when we speak of that. So why must we take these vaccines that would probably be more essential for the older audience and vaccinate young people who are unlikely to feel unwell?
So the line is a bit unclear, but the way it's working is that when, say, a person is vaccinated, we must remember now that these vaccines are not 100% effective. But if you are vaccinated compared to a non-vaccinated person, then you will have a lower viral load, and the period of time that you will now shed the virus and also infect other people will also be lower, or shorter. So in that way, young people will also protect these other people around them. And in addition to that, hopefully when we start, vaccinating the younger people, they will also take the elderly people at home to the vaccination sites, those that we haven't reached yet, which are so important that we are able to get hold of them and get them vaccinated because they are the fragile ones.
What are the risks after vaccination and how widely spread are these? For example, there have been certain reports in the UK of the swelling of the heart muscles in some instances as a side effect after taking the Pfizer vaccine. I don't know how much information we have or data around the safety of these vaccines in young people.
These adverse events or effects that you're referring to, they are very, very rare. So the effects that we are seeing at the moment and the ones that we are expecting to see from the clinical trials, they are all very mild and minor. So they appear within the first couple of hours, but they subside by themselves usually within the first 2 to 3 days. So those inflammation of the heart muscle that you're referring to, those are very, very, very rare events, and they are all manageable. So should anybody present with any of those effects, then they can be managed. That's why we urge people to report anything that is of concern. So if you do experience something out of the ordinary after you had your vaccine, don't just assume that it is because of the vaccine, especially if these symptoms become more severe or when they are out of the ordinary, not the normal swelling, a bit of headache, a bit of fever, and so on. Then you must report those effects because they can be managed.
Yeah. Then there is the question, Prof, which we touched on earlier on of herd immunity. And I suppose the skeptics are saying, well, government is so interested in getting this herd immunity that they feel that let's just add more people so that we can reach that number quickly. What are the benefits really of this herd immunity if you were to break it down for us?
Well, the benefits is that, when you reach herd immunity, it means that the majority of the population has either been vaccinated or they have acquired, natural immunity after they've had the disease. Now, we know by now that your natural immunity is not long lasting. So you get a lot better immunity and protection from your vaccination. So if we can achieve herd immunity, which we believe now we will not be able to, because it depends on how effective the vaccine is, how many people have we vaccinated, and then, as I said, for how long this immunity will last. So the more people we get vaccinated, the fewer the opportunities for people to be in the population that is now vulnerable to the disease and that's not protected, and then the fewer the opportunities for the virus to spread. And if we don't spread the virus, it also means that the virus won't mutate. And then we sit with new mutations. So when we get new mutations, that's when we now have a problem again with how effective is the vaccine, how rapidly spread the virus. So these mutations determine how can we actually manage the virus. I
was coming to that question of mutations. Does herd immunity help with the mutations? But also, the concern, Prof, is that, for example, I was reading in one of our bulletins yesterday that the United States has now approved a booster shot because they are unable to deal with the Delta variant. I mean, will we find ourselves in that situation as well?
At the moment, we fortunately, the two vaccines that we are using here in South Africa works very well. It provides very good protection against severe disease, hospitalization, and death. And that is what we are aiming for. So even after you have been vaccinated, you can still get the disease because these vaccines are not 100% effective, but you are not going to get severe disease, hospitalization, and maybe die. So what you asked about the third shot. So there's still a lot of research being going on, although you said now that the US has approved a third shot. But what's also important to remember is we first need to give as many people as possible the opportunity to at least get the first shot, because we know that we are getting good protection from that first shot. And also some of the data from the J&J vaccine has now shown that the vaccine definitely provides long-lasting immunity for already up to 9 months. And, as we are making progress, more data will become available. So it wouldn't really be ethical to now start vaccinating people again, give them another shot, while a large majority of the population hasn't even been able to get a single shot.
Yeah. For the educators, I suppose for the teacher unions as well, the important question would be, now that we're saying we are vaccinating this particular age group, which some of them are still at school, will this lessen a surge of cases at schools? Will this mean that fewer students will have to isolate and miss school?
Yeah, well, definitely. I mean, obviously, when you vaccinate more people, it will help. But we must remember that you can't say now I'm vaccinated and now I can just function like I always did. So people still need to, all the teachers and the children at school, they still need to follow all these non-pharmaceutical interventions like social distancing, open up the windows, wash your hands, wear your mask. If they don't do that, then the virus is just going to continue to spread because everybody is not vaccinated. And although you are vaccinated, you can still get infected and still spread the virus to other people. So that's why it's extremely important to do that together with the vaccination. And that's the only way that we're going to get hold of the pandemic.
And if you have a look at how the things have progressed with particularly the over 35s, are we likely to see same degree of hesitance in young people, or you think the younger audience will be more takers?
Well, if you look at the latest surveys, both surveys that's recently been sort of released, among the younger age group, only 55% of them indicated that they are willing to get the vaccine. So we've seen that hesitancy is more amongst the younger people compared to the older people. So older people seems to be feeling, more at a higher risk. I mean, obviously they are older, so they're more vulnerable. They have more comorbidities. So it is a bit of a problem, but I think what we need to do is now really reach out to the younger people. They have different needs, they have different opinions, and you can't reach them in the same way that you reach the rest of the population. So you need to reach them in ways that actually appeal to them. Get them involved in your communication, in your interventions. Get people to engage with them that they actually trust. Because trust is a very important part of vaccine hesitancy or, in our interventions to work against vaccine hesitancy. So, for example, you can use sports leaders, even church leaders. I spoke to some of my students earlier this evening, and they were actually saying, why don't you get these people who's on TV each and every night, these soapies, young generations, and so on. Get them to vaccinate, let them share their stories, because those are the people that the youth are trusting. And then also something that's a concern, it's always a concern when it comes to vaccine hesitancy. The main reason is the safety of the vaccines. So although we talk a lot about the safety of the vaccines, but people are still worried, they're scared. What's going to happen to me? What will I experience? So if you use these role players or champions or heroes or whatever you want to call them, then and they can share their experience of the whole vaccination, what kind of effects that I have, was it like this or like that, then people can relate to it and they listen to it because it's stories. They now speak from their own heart, can I say. And this is what makes an impression on people and have an influence on them.
I think that's the word, Prof. The young people would like to use not heroes, but they like to call them influencers. And I'm sure your students have something there on that particular one. All right, Prof, I appreciate your time. Thank you very much for joining us tonight. Professor Hannelie Meyer, head of the South African Vaccination and Immunization Center at the Sefako Makgatho Health Sciences University.